Hi guys, Dr. Moses, general pediatrician. Today I'm going to be talking about developmental milestones, basically what your child should be doing at different ages. This is not going to be a comprehensive list by any means, so if your child is not doing certain things on this list, that does not mean they are delayed by any means. This is more or less just a guide to help you see where your child is and what to look forward to as they get older. If your child was born prematurely, you can't go based off this list because they will probably fare better with their adjusted age as opposed to just going based off of what their age is now. So let's get right into it. So a 1-month-old child should be able to lift their head when they're prone. Basically, if they're lying on their belly, they should be able to lift up their head and also turn it from side to side. They should have their hands fisted most of the time. Usually most newborns or 1-month-olds have their newborn reflexes still present. That's your grasp reflex where you put your finger in their hand and they're able to grab it. The startle reflex is still there. They respond to sound by either turning their head towards it or just, reacting. And at this age, they fixate a lot and just like stare at objects, staring at a light and things like that. Now, a 2-month-old this is where you start seeing the social smile. They're smiling at you while you're talking at them, smiling to them. They start cooing at this age too. If there's a loud sound, they may react with a startle or react by turning their head towards the sound. Their hands are unfisted half the time and fisted half the time. So you should see your 2-month-old hands open sometimes and they're closed at other times. When they're doing tummy time, you may see them put their head up and a part of their upper chest and hold it up there for a while. They should be able to track you for about 180 degrees or track an object and kind of just follow you as you're moving along. Their movements are a little bit less jerky at this age, and you see them moving, both arms and legs in a more meaningful manner. And they're looking at objects, looking at your face for several seconds at this age. And then we go on to a 4-month-old child. At this age, they are able to sit up with support, good head and neck control at this age. During tummy time, instead of just a head and chest up, you'll see them with their full arm and elbows and being able to do, something like that as well. Some babies at this age are able to roll from their belly to their back. They're putting objects in their mouth. And if you were to put something in their hand, they may hold it and actually stare at what they're holding or even just look at their hands while they're sitting there. If they're sitting and facing this way and you start talking, they should be able to turn their head to the sound of your voice. And instead of your social smile, you may actually start hearing them laugh and laugh out loud. They enjoy looking around. And when they're hungry, you may notice that they open their mouth, whether when you bring something close to it, like a bottle or even you're breastfeeding, you see them being able to open their mouth right away when they're hungry. And displeasure if social contact broken. And then going ahead to the next age, which is your 6-month-olds, these guys are rolling over from the back to the belly. So at this age, you're essentially able to roll back and forth. Sitting with support of their hands, so more like a tripod position. So the baby's sitting and they should be able to sit with their hands on the ground, supporting them. Some babies are able to creep crawl, meaning basically they're not crawling yet, not on all fours, but they may be able to kind of inch forward when they're on their belly. They're able to pass objects from one hand to another. If they have, a toy in this hand, they're able to move it to another hand. And during tummy time, they're able to reach for things with the right hand and the left hand. There is really no hand preference at this age just yet. They're able to tell a parent from a stranger, meaning if, you're holding your child and I come to try to take them away from you, there's definitely a reaction of who's this person. They imitate banging motions at this age. If you were to put them in front of a mirror, they like to stare at themselves and sometimes even pat the mirror. They're blowing raspberries at this age, basically, sticking their tongue out and blowing. And they're able to put things in their mouth, pick up things and put it in their mouth at this age. And during tummy time, you'll see them, instead of doing this like a 4-month-old, they'll be able to kind of do one of those things. When they're laying on their belly, just put their arms out, fully stretched. And then going on to the next stage, our 9-month-old group, at this stage, you're able to sit, without support, back up straight. Some babies at this age are crawling on all fours. Others are probably still army crawling, where you're on your belly and kind of just pulling yourself forward. Babies usually, when they crawl, they kind of push themselves backwards initially. This is all part of the whole growth and development. Some babies are able to pull up to stand, so they're in their crib and they're able to grab the side and pull themselves up. Some babies are able to walk while holding their hands, so they're able to know what to do, taking steps while holding their hands. Some babies are cruising, putting their hands on furniture and moving from side to side. If you have, small foods on the table, some babies are able to rake that movement to pick things up. Some babies are beginning to use less fingers and maybe a thumb and 2 or 3 fingers. So they're practicing the pincher grasp, which is this, and that typically is developed fully around 1 year of life, 12 months. Other things you're seeing is the baby should be able to hold a bottle or hold a sippy cup at this age and kind of feed themselves. They're alert to the sound of their own name. Some babies have 1,000 nicknames, so this may be hard. So try to call your baby by the name you have given them, not, boo boo and gaga. Just call them as much as you can by the name you have given them so they know what their name is. A lot of babies are saying mama, 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 ba, 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 ba by now. At 6 months, they're babbling. At 2 to 4 months, they're cooing. But at this age, you're actually hearing mama, 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 ba, ba, ba. Nothing specific. And if they're doing something and you say no, they should be able to pause because they hear almost like the different tone in your voice. They may still do what you're saying no to, but you should see them pause or stop when you say no. And if they want to be picked up, or if you want to pick them up, you may see them actually put their arms up to be picked up at this age. And they're very visually attentive to the environment and, very interactive at this age as well. And then at 12 months, a lot of babies are able to stand by themselves at this age. A lot of babies are walking by themselves at this age. Again, if your baby is cruising at this age, that is perfectly fine. If your baby is only pulling up to stand at this age and crawling at this stage, again, that is perfectly fine. This is really just a guide of where most babies are at this age. So at 12 months, you should be able to throw an object, basically a ball or something in their hand. They should be able to throw it across the room. Some babies are putting objects into a container, so like a ball or a toy or a Lego, they should be able to pick it up and put it in a bucket. Mama and dada is a lot more specific at this age. So mama is mama, dada is dada. Babies are also pointing with their forefinger at this age. And that pincher grasp I talked about, they should be able to pick something up with these 2 fingers at this age. They're imitating simple sounds as well at 12 months. They enjoy looking at picture books, and between 9 and 12 months, they should be able to uncover a hidden object, meaning if they see you put, a pacifier under the blanket, they should be able to go there, lift up the blanket, and take that pacifier out. And also when you call them, they should be able to crawl to you or come to you. And when dressing, they should be able to cooperate, meaning know to put their hands through the hole and put their head down when you're putting the shirt or top over them. So that is basically, the gist for the first year of life. I know that was a lot, so you can go through the video again, pause it, at different ages to see some of those things. Again, this is not a comprehensive list. If your child is not doing any of those things, it is okay. Not every baby is going to hit the milestones at this age. Babies grow at their own pace. But if your baby is not doing anything on the list, certainly talk to your doctor to ensure that they are on the right path of growth and development. The next video is going to be for the next age, 12 months and over. Until next time, stay blessed.